Great, thanks, David. So first of all, I want to thank John Balms, because that was an outstanding presentation. I don't know where you disappeared to, but and it was really the perfect introduction to what I'm going to give, which is some of the latest for PM in terms of the integrated science assessment, the exposure and risk assessment, and the policy assessment. And also just to clarify too, I am in the regional office, not the Office of Air Quality and Planning Standards, which actually sets the NACs. We're very much on the implementation side of things. So I'm an air quality risk assessor in our regional office, and we work with ARB in the district to put this into practice. And so maybe that'll be obvious as I go through. So I can pretty much skip this slide, but I did want to note that focusing on the results from the ISA, the risk assessment and the policy assessment, it does really get to questions 1, 4, and 6 that were posed in our agenda. So hopefully I'm not diverting too far from David's plan. So this can be quick, because actually John already said it. We are directed to set the NACs. We are directed to review them, working with KSAC, and really that's the process I'm going to focus on here, which is we're looking at the PM NACs currently. It's scheduled for the proposed rulemaking in February 2011, and the final rulemaking is scheduled for October 2011. So in support of that rulemaking, there's 3 particular documents that are now out in various forms. The first document is the integrated science assessment, which has been finalized. So it's gone through this, first draft, second draft, with KSAC, with public comments, and as of December 2009, it was finalized. And I actually laughed when Dr. Baum said that these have gotten smaller, because certainly I don't have the perspective he does working in this, but this integrated science assessment is over 2,000 pages. So it doesn't feel very small to me, but I think it's pretty good for PM. So that's finalized in December 2009. The risk and exposure assessment has actually gone through the second review draft. It's gone through public comment. We're currently working through KSAC. It should be out any day now in its final form. And I'm going to show some risk results specifically to the Fresno area. And then finally, the policy assessment, the first draft was released for public comment. Oh, actually, the first draft is on our website. So, downloaded it last night, so it is there. I might have to update my slides, but it's gone back and forth with KSAC, and it's out for public comment. So, and we anticipate going through the first and second drafts of that, and then of course finalizing that in September of this year. And that's the website where you can find all these documents. So here's the actual conclusions. So no more process stuff. Here's actually what the documents say. And first of all, one of the conclusions is, of course, that there's extensive health evidence for both short and long-term exposures to PM 2.5 based on the EPI studies and other studies, as Dr. Balms mentioned. In the integrated science assessment, EPA scientists working with KSAC and with public review make weight of evidence judgments on these relationships. And the strongest weight of evidence is a causal relationship. That's the first thing that's underlined there. I do have a pointer, good. And the second one is likely, third is suggestive. So for those who are familiar with cancer assessments, this tracks very similarly. So this first one is the highest, which is for PM 2.5, they found their judgment, the scientific judgment was there's a causal relationship between both long and short-term exposures to PM 2.5 and cardiovascular effects and mortality. And there's a likely causal relationship between long, short-term exposure and respiratory impacts, and a suggestive relationship for cancer and developmental effects. Again, I think this is not a surprise. Last couple of days we've been hearing about this, so I'll kind of move on. But this is a very strong judgment. For the PM course, which is the size between 2.5 and 10 microns aerodynamic diameter, their conclusion was that it's suggestive of a causal relationship between short-term exposure and cardiovascular effects, respiratory effects, and mortality deaths. So, I thought it was really, Dr. Gordon presented this morning some evidence for that coarse fraction being particularly toxic. That's the type of evidence that I think is a little bit discussed in the report, but That's the type of evidence I think we just need more of, but certainly the weight of evidence is suggestive. And then finally, for ultrafines, we've heard a lot about it. Again, it's a suggestive relationship. I'll talk a little bit more about PM coarse and ultrafines later. The other thing that the integrated science assessment had was, it's chapter 8. It's one of my favorite chapters, kind of embarrassing. But it talks about vulnerable populations and makes a weight of evidence judgment on the science and whether a vulnerable population might moderate the effect between exposure to PM and health endpoint, and found that there was a statistically significant and clear across studies relationship between older adults and children, meaning, like, for example, older adults are more likely to have pre-existing disease, and so that can make them more susceptible, and so they would see a higher impact from the same PM exposure level. Genetic factors, that was mostly genetic polymorphisms, which people in the room know way more about than me. Like I said, existing cardiovascular disease and respiratory illness in a population makes you more susceptible to the PM effects. And one of the ones that's actually gotten studied quite a bit recently is socioeconomic status and some of the measures for that. So one of the most commonly found relationships is in areas with decreased educational attainment, you're more likely to suffer the impacts from PM 2.5 exposure. And I think that's obviously very relevant in the Valley. I pulled the numbers, but the point is, we have about, I think in the Fresno area, it was something like 70% of the population has attained a high school diploma, and the nation is about 85%. So of course, that would say that we're in an area of low educational attainment here, just like in the Southern Valley. And so that makes the people here more susceptible to the same levels of pollution. And of course, there are higher levels of pollution. So that's the first document. That's 2,000 pages summed up in 2 slides. The second document is this quantitative health risk assessment for PM, and this is also called the risk and exposure assessment. Here I just wanted to emphasize that there are several pieces of information that go into the risk assessment. For those in the audience that are starting to do this type of thing, you already know this. I'll try to kind of make it pretty basic for those who don't do this type of modeling. Where essentially what went into it is, for this particular assessment, looked at monitored data across the country for various size fractions of PM and various timescales. And then one of the things that was done for scenarios, meaning different levels of standard, was to do what's called monitor rollback. And there's various ways of doing a monitor rollback, but one of the ways is just to say, if you're at an annual standard, the existing standard is 15 micrograms per meter cubed annual and 35 24-hour. So if you're at 17 annual and you need to get to 15, it just rolls back all the monitors in the area, not just that peak design value monitor, from 17 to 15, so whatever percent that is, 3%. And then just rolls it all back proportionally, and that's one of the methods, a proportional rollback. There are other methods described in the document, which I won't go into here. Then it combines that information on what people are, it matches that with the EPI study. So using this kind of regional ambient monitors is a good match for the EPI study, so that's the exposure concentration. Then it uses the EPI studies. In this case, we used the Krusky 2009, which is the Acs Re-Analysis. And essentially what that is it's for those who don't know, it's a very large epidemiological study looking at 18 years of data across a population of 1.2 million people in the United States. And they came out with a paper supported by the Health Effects Institute that did a very extensive analysis of both that data set and other data sets to come up with a concentration response function. That was used in this study. For those who are kind of junkies in this type of thing, I'll say that it was the random effects Cox model with ecologic covariates. If that doesn't mean anything to you, don't worry about it. But just want to tell people, I had to get that out. And